Good morning, everyone. Here we are again to conduct a Q&A. Barbara's joining me and we'll go through some questions that we've had from the inquiries from my website. So Barbara, let's kick off with the first one.
Okay, Dr. Sibthorpe. Tessa is asking, I have some sagging and slight bulge near the corners of my mouth. Can derma fillers treat this? I had cheek fillers which didn't help or give me any lift.
Okay, so sagginess around the corner of the mouth. Now this is quite a difficult area to treat. Typically you would want to use cheek fillers or mid-face volumization to give the lift, which in itself will lift up the corner of the mouth, but that's not always possible, so that you find that there's a muscle here that pulls down, which you can treat with Botox, and you can also strengthen the corner of the mouth directly by using some very fine filler, typically in the superficial plane, as what we call a myomodulator, which affects the pulling down of the muscle to stop that pulling down.
So is she basically asking, when you have that droopy smile where smiles aren't lifted, there are a lot of young girls I see around who have such good smiles.
Yeah, I think you're referring, is it to this where the corners are turning down? So that does happen, as I said. You can, if there are changes that have occurred in the mid-face that have caused that, then obviously address that issue, or you may have to treat that directly with using Botox and or filler.
But that's treatable.
It is treatable. I think it's also important to have realistic expectations about the result, the outcome. You may not completely correct it, but certainly you should be able to improve it.
Okay, good. Justine writes, I recently noticed that I am flexing muscles around my nose when speaking. Oh, I've seen that before. I didn't realize it before until I saw it on video. A video someone took of me when I was talking. Can Botox help with this?
Yes, so I'm guessing what you're referring to is bunny lines, which you do when you do that.
Yes.
So that is very easily treated with Botox. It's a simple procedure. Usually we use 3 points, typically on either side, and one across the top of the nose here to stop that.
Okay, Justine, it's fixable. Maria is asking, I'm only 20 and I have lines around my mouth. I have had these lines all my life, but they're getting worse. Is there any way to fix this? It's almost like the other question that we had.
Yeah, I think that maybe this is referring to what they call these sort of very fine lines around here. And some people will have those at an earlier age than others. In that particular case, we would probably use more of a skin booster or a hydrating type of filler, because the lines are usually very fine. We also want to use a filler that does not add any volume. So we don't want any bulkiness being created there. We really want to provide some strength to the skin, and there are different techniques that you can do to do that. And typically we want to hydrate that skin in the area, because we do get a lot of fine lines and wrinkles all around the mouth, not just here. And typically that's easily treated with a skin booster type of filler.
That's
so
good
it's
to
a
know.
fine filler.
George is asking, I have hollows under my eyes. I don't know if it's because of a delicate area, but I'm nervous that it is a delicate area. Is there a treatment that's safe and effective?
So hollows under the eyes, we usually call those tear troughs, or they're referred to as tear troughs. And yes, we will use a filler to treat that area. It is a very delicate area, so it's important to use the right type of filler. Typically, it's a finer filler, and it's also placed at a deeper depth, so it's not so visible, to avoid things like Tyndall effect, which is a blue discoloration, or any lumpiness or swelling. It's a delicate area also from the point of view of the treatment itself, because There are some nerves and vessels there, and so it needs to be done by an experienced practitioner. You don't want to be injecting into arteries and things like that around that area.
Okay. Rose is asking, I'm 51 years old. I don't know what to do about my neck. Botox, fillers, neck lift. I just don't know. Help.
Necks. Usually we treat those with fine fillers. Again, the skin here is very thin. So if you use a filler that is a little bit, if it's not a fine filler, you will see it. It will be very obvious. You'll get the lumps and bumps. We will use non-cross-linked fillers, things like Profilo. It is very good for necks. Or we use things like hydrators. Again, we're back to the skin boosters for using in that area. Very occasionally we'll use Botox in this area where you may have platysmal lines, and I don't know whether she has that as well. It's possible. I suppose that comes back to a careful, detailed assessment as well.
Well, since we're talking about Botox and fillers and hydrators, people always ask, or some people don't ask, what supplements or vitamins should you not take before you get Botox, before you get fillers?
So the ones that we're interested as practitioners for you to avoid are those that essentially thin the blood and therefore would give an increased risk of bruising. So things like omega-3, non-steroidal anti-inflammatories, St. John's wort. There's a sort of an odd assortment of supplements. So it's best generally to avoid most things prior to treatments. And as I said, the risk really is from thinning the blood, making it easier to bruise. So it's best if you can come off of those, usually a couple of weeks before treatments.
Like aspirin as well.
And aspirin, of course, that's another one, yeah.
A couple of weeks or 5 days?
5 days, but I mean, if you have the opportunity to make that longer, then it will help.
Okay.
Yeah.
Well, no more questions. That's it.
Okay. Well, thank you for today. If you have any more questions, please do go to my website and submit your questions via that route. Thank you.